أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين. Now, with the courtesy of the Searle Pharma, Pakistan, they arranged CME program on 28 November 2022 at the Federal Bay Area, Karachi. The 15 participants attended the meeting, and the topic was: is combination therapy is more beneficial or effective as initiation of therapy in the stage 1 hypertension. I am Professor Syed Ali Hazar. I am visiting Professor of Medicine at Jinnah Sindh Medical University. The scenario try to understand is a very common problem. A 32-year-old executive of BMI 34, means obese, has arrived in the medical OPD for the routine medical checkup. On examination, temperature was 99 degrees Fahrenheit, pulse was 104 per minute, sinus tachycardia, blood pressure right arm is 145 by 98, and left arm was 140 by 100, A2 loud at the aortic area, brownish pink macules noted around both eyes. The hemoglobin is 16.7, slightly erythrocytic because he's a smoker probably, and he has a TLC of 9,000, blood pressure is 320,000, random blood sugar 198, and probably hemoglobin A1C is required here. That patient is diabetic or not, he is not known diabetic. XHS showed the minimal cardiomegaly. The question: how will you further investigate? Definitely all parameters should be checked. Along with it, the fasting blood sugar, the FLP, the urine creatine electrolytes, urine RNA examination, and ECG, ultrasound of the abdomen, ultrasound of the KUB. These should all be done echocardiography in certain cases, and liver function test and serum uric acid. How will you classify this case? Now this is important. When you classify according to the GNC 7 or GNC 8 classification, joint national conference, which is endorsed by the WHO and American Cardiac Association or American Heart Association, that the what is called prehypertension is normal blood pressure is systolic 120 to it should be less than this, and the diastolic should be less than 80. If it increases to 120 to 140, it is called prehypertension or high normal blood pressure accordingly. Secondly, the stage 1 hypertension is more, if the systolic is more than 140 and diastolic is more than 90. So 150, 140 by 90. If it increases to systolic 160, then it is stage 2 hypertension. Diastolic is more than 100, stage 2. Still more than 180, stage 3, according to GNC 8 classification. So I classified it in the stage 1 hypertension. The European classify 135 is the limit for them, and they classify after 135 systolic stage 1 hypertension. This is the difference between European and Americans. So which classification you follow, I don't mind. How will you initiate therapy? This is the problem. Now, in most of the cases we initiate the monotherapy, of course. Monotherapy should be given with the primary prevention. And what will happen if this case is not treated? The complications of hypertension will occur. The patient will go into the evidence of cardiomegaly. He will go into left congestive cardiac failure. He may suffer from retinal problems, he can suffer from stroke, peripheral vascular disease, etc. Now this is how this case scenario was given to me actually.